I'm Dr. Jennifer Levine. I am a double board certified facial plastic surgeon coming to you from the Upper East Side of Manhattan, and today we are talking about lips. You know, Valentine's Day is right around the corner, and we all want those luscious, soft, pouty lips that still look natural. So I think that looking natural is really important no matter what size lips you want. You could have small lips that are looking natural and big lips that are looking natural. And in order for us to understand kind of what does natural mean, we're going to first review some lip architecture, because everybody's lips have specific parts to them, and these are important anatomic considerations to take into account when we're injecting them. Okay, so if we look at this picture here, we can see these lovely lips right here. And what I want you to note is that in this picture, the size or the relationship of the upper lip to the lower lip is about 2 to 3. So we never want the upper lip to actually be bigger than the lower lip. There are some exceptions in which the top lip and the lower lip may actually be 1 to 1. Someone like Julia Roberts may have something a little more like that, and that's okay too, but we don't want the upper lip to be much, much bigger than the lower lip. Okay, so if we look at this area, it's important to know that the lips are something called the perioral complex. So there's parts of the lip area that don't involve just the red lip. For example, we have the white lip, which is the skin around the mouth itself. We also have the philtrum, which are those little columns that extend from the base of the nose to the top of the lip. Then we have something called a white roll, which is that little highlight that goes around the top lip. And then we have the vermilion border, which is the actual where the red lip starts. That's actually a really important anatomic landmark to line up, because even if that's off by 1 millimeter, let's say if you were unlucky and got a cut there, that's something that's visible. The other important thing to realize is there is something called the oral commissure. As we get older, the corners of our mouth may droop, and that indicates that some volume may be lost from that area. So there are young people who sometimes have a deficiency in their oral commissure, and sometimes older people do, and in order to have really pretty lips, the lips have to be supported. So if your face is not well volumized, or if the area around the mouth is not well volumized, your lips are not going to look as pretty. So that's another important consideration. The other important thing to realize is there's some facets or parts of the area that are always a little more plump than others. We see those in the center of the lip and also in the center of the lower lip. So these are qualities that we see in really, really pretty lips, and things that we want to replicate when we're doing filler. So the other thing is that there are so many different products to inject in their lips, and people are always asking me, like, which product should I use? So I think with the lips, it's really important to go slow. So if you're not really sure if you want really big lips or you don't want big lips, all of the lip products make your lips swell initially, so you kind of get the idea how they would look bigger. And it's probably better to start with a product like Volbella or Restylane Silk, which is going to mainly hydrate the lips, smooth it out, and give you an idea about how a little bit of volume might look. Once you decide that you actually want bigger lips, then you may actually want to go with more of the Juvederm type products, and you want to add the volume little by little. So let's say if you're looking to get to something like a Kylie Jenner lip, you're probably going to have to add a syringe of filler every couple of weeks until you get more to that point. The reason that you don't also want to add too much filler too quickly is that the lips are a very vascular area. So there's a lot of blood vessels going to the area, and you never want to have something called a vascular occlusion, which means that you accidentally inject into a vessel and cause necrosis. So that can occur either by injecting directly into the vessel, or if the lips are overwhelmed by too much product at once, it could then cause some compression of one of those vessels, and that's something that we really always want to keep in back of our mind, and we always want to have things available to correct that if there's a problem. So
we have a few questions, Dr.
I love questions.
So what I think a lot of patients get nervous because of the Kylie Jenner trend. So what would you tell someone who is maybe interested in getting their lips done but doesn't want to necessarily have lips that look like Kylie's?
So I think that's a great question. I think that it's very hard to get Kylie Jenner lips. So she's had many syringes of filler to get to that area. And I think it's important to start with a filler that's kind of very soft and more smoothing, like Bella or Restylane Silk. That's not going to really add a lot of volume, but it's going to help with some of the texture and quality of the lips, maybe remove some of the lip wrinkles themselves, and more just hydrating in general, and that's a good way to start. And as I said, those products do swell slightly, so you could kind of get the idea of how bigger lips would look on you, but then they go away.
What can someone expect when they come in for their lip filler treatment?
So lip filler is a very quick treatment. You kind of come in, we put on some numbing cream, you're going to sit with that for a few minutes, and then the lip injection takes about 10 minutes. You sit with a little bit of ice, and then you kind of leave. And then you'll kind of feel that your lips kind of feel a little bigger, both from the numbing cream and the product. And it's normal for the product to swell kind of overnight and into the next morning. And depending on the product that you use, the swelling goes down gradually. But it's usually worse the morning after it's injected.
And how long does the filler last in the lip area?
I think that filler lasts depending on what kind of look you're going for. So if you kind of like a fuller lip, then you might want to do the lip injections more frequently. But I would say on average, you want to probably do the lip filler about every 6 months.
Okay, great. And then what I guess is the youngest age that you would recommend? I think a lot of young girls want to maybe do their lips. So how young could someone potentially do it?
I think that, roughly like 18 is the right age to do this, when the person's kind of responsible for themselves, isn't only interested in the trends, is kind of able to sign the consent form themselves, is kind of what we're going for. All right, well, thanks for all your questions, and thanks for tuning in, and give us a call. Bye-bye.